Fiscal year 2020 started on July 1st, 2019, just like any other year at Natividad. Our first two quarters were solid, and in January 2020, we were on a trajectory to close the year on June 30th with a positive margin exceeding budget. Natividad's Level 2 Trauma Center celebrated its 5th anniversary this year. We had recently completed the final draft of our 3-year strategic plan, which focused on growth, integration, and patient experience, and we're ready to present it to the Board of Trustees. We were also anticipating our unannounced survey by the Joint Commission, and our teams were focusing on ensuring readiness on this critical 3-year survey. Our acute rehabilitation center had received national ranking in the top 10% of inpatient rehabilitation facilities. It was also awarded Kindred's Uniform Data System for Medical Rehabilitation Top Performer Award for the 3rd year in a row. We received Leapfrog's A safety grade in fall 2019 and spring 2020. The grade is a national recognition of how well the hospital protects patients from infections, accidents, errors, and injuries. Natividad Medical Group had moved to a larger, updated space within the hospital to provide family medical services to more people in our community. Later in the year, Natividad was named one of Newsweek's Best Maternity Hospitals 2020. The distinction recognizes facilities that have excelled in providing care to mothers, newborns, and their families, as verified by the 2019 Leapfrog Hospital Survey. Last summer, Natividad Family Medicine Residency welcomed 10 new physicians. Our recent efforts to recruit diverse applicants committed to serving our community have been effective. 70% of incoming residents speak Spanish, 60% are Latino, and 70% are underrepresented minorities in medicine. We also graduated 9 residents, 4 of whom continue to work full-time at Natividad. The residency also received the highest level of accreditation offered by the Accreditation Council of Graduate Medical Education, also known as the ACGME. In 2019-2020 recruiting season, we received 1,200 applications for our 10 positions. This year, Natividad Foundation received grant funding to sustain our new program providing medication-assisted treatment, MAT, for opioid use disorder, which Monterey County has well publicized. Health Caring campaign had launched and was playing across all local television stations and in print, digital, and outdoor. Other projects at the hospital, such as the Radiology Modernization Project, continue to make great progress, while some capital projects that have been well funded by donors have been put on hold while Natividad deals with the pandemic. Natividad was incredibly busy with greater than budget census, and when we entered the new calendar year, the future looked bright. Then, on January 4th, 2020, the World Health Organization, the WHO, reported a cluster of mysterious pneumonia cases from China, and the novel coronavirus made international headlines. The first confirmed U.S. case of COVID-19 was confirmed in Washington state on January 21st. Just a few days later, on January 26th, the first cases of the disease were diagnosed in California. By the end of the month, Natividad had tested its first patients for the virus. At the time, just 12 people in the United States had tested positive. On January 30th, the WHO declared a public health emergency of international concern. On February 11th, the 2019 novel coronavirus disease officially was abbreviated to COVID-19. On March 11th, the WHO declared COVID-19 a pandemic in response to the alarming levels of spread and severity and the global community's lack of action. On March 17th, Monterey County Health Officer Dr. Edward Moreno issued a shelter-in-place order. Then on March 19th, Governor Gavin Newsom proclaimed a state of emergency and announced a statewide shelter-in-place order. In April, New York, which did not have mandated shelter-in-place or masking orders, became the pandemic's epicenter. Weeks before the pandemic became official, Natividad's Emergency Operations Center, EOC, planning group had begun daily meetings and activated our Hospital Incident Command System, also known as HICS. We were preparing for every possibility and broader spread of the disease, and we weren't going to take any chances. Natividad is no stranger to planning for disaster. It is part of our culture. As a hospital accredited by the Joint Commission, we must activate our HICS emergency response twice a year. Natividad has long planned and practiced for emergencies, including natural and industrial disasters and other mass casualty events. For COVID-19, our leaders realized we would need to take a proactive, innovative approach to train, prepare, and be ready for a deadly, complex disease on its way to becoming a pandemic. Made up of clinical, managerial, and administrative staff, HICS first met 7 days a week. After our initial planning was completed, we were able to decrease the frequency of our meetings. We continue to meet regularly to ensure that the plans, equipment, and procedures that will allow us to care for our patients and protect our staff are all in place. Our team is diverse, and each person acts in various capacities within their roles and responsibilities. Doctors, nurses, lab, operations, administration, engineering, housekeeping, IT, human resources, marketing, finance, materials management, quality, and Natividad Foundation all work together and respect the different areas of expertise brought to the table. At each meeting, we discuss staffing, persons under investigation, isolation room availability, lab results, personal protective equipment, also called PPE, and lab supplies, communications, and new developments. We also review other issues to ensure that work is completed, and we follow up on pending items requiring discussion. Our goal is to prepare for and respond to COVID-19 and ensure that operations are effective and efficient. Since minute one, our team at Natividad has treated COVID-19 as an airborne disease. In the beginning, there were a lot of unknowns and conflicting information. Plus, the virus was new or novel, so we didn't have much information. We decided to play it safe and assume that this virus was highly communicable and possibly transmissible through the air we breathed. That meant that our staff, from our nurses to our doctors, to admitting to environmental services, had to have the right equipment to protect them from getting sick. It also meant that we had to develop a plan to keep our patients safe. In the first week of March, Natividad's emergency management team ran a code triage mock scenario complete with a disaster simulation drill. Our goal was to test our emergency preparedness and response plan. The exercise helped us to identify our weaknesses and recognize our strengths. By the end of that week, all 4 Monterey County hospitals developed plans for alternative triage for patients presenting at the hospital with a fever or cough. One thing about a pandemic is that everyone is affected, which meant that we were all competing for the same resources. Sadly, the city hardest hit by the virus at first was Wuhan, which was also a hub for producing personal protective equipment, or PPE, such as surgical masks. Materials management worked around the clock to ensure enough PPE. We worked with the MOAC to secure supplies. Very early on, we saw weaknesses in the supply chain, and hospitals, assisted living facilities, and healthcare providers across the world were competing for those same resources. We forecasted out our supply of N95s and other PPE, cleaning supplies, soaps, and hand sanitizers. Our PPE committee, which was part of our HICS team, continues weekly reporting for our burn rate of PPE and days of inventory on hand. With the support of Natividad Foundation, we bought additional PAPRs and CAPRs. PAPRs are power air purifying respirators, and CAPRs are controlled air purifying respirators. We looked at emergency supplies and sent some past shelf life masks to the CDC to ensure their efficacy. We sent non-medical grade surgical and N95 masks to local agricultural workers so they could work more safely in conditions where they can't physically distance from others. We began looking at creative and unconventional supply sources as we were using up more PPE than we ever had. We reinforced hand hygiene guidelines and physical distancing for employees. Nursing, quality, and human resources coordinated training on personal protective equipment, PPE, for our clinical staff. We required gloves, gowns, N95s, and face shields, or PAPRs, CAPRs, in many parts of the hospital and medical tents that cared for suspected or confirmed COVID-19 patients. We held training several times a day, every day of the week, so our staff knew how to don and doff PAPRs and CAPRs. We mandated a universal masking policy for all employees. In addition to training, we developed signage and pictograms for staff for PPE, guidelines for transport, what process they would follow, what cleaning procedures would need to take place, and when. We put signs on doors to alert our colleagues if the room needed to stay empty. We put images of the PPE that was required for different situations. With signage, we reminded our employees and our patients to sit 6 feet apart from one another. At first, we and other hospitals and testing centers had all COVID-19 tests closely monitored by the Centers for Disease Control and Prevention, the CDC. In February, there were just 1,200 tests available in all of California, and the CDC decided which patients they would approve to test. At the time, all COVID-19 tests had to go to the CDC to Atlanta for processing. Also in February, Santa Clara was granted permission to do this testing, and by May, the Monterey County Health Department got the okay to do their own testing. Natividad had in-house COVID-19 testing by June, with results that came back in hours. As a service to our community and response to the Board of Supervisors' request that more testing become available, Natividad, with Natividad Foundation's financial support, provided testing in several locations in Monterey County with limited access to tests, including Seaside, Marina, Castroville, Chular, and King City. People enjoyed the low barrier access that drive-through testing affords. Just as PPE had proven susceptible to supply constraints, we discovered that it was vital to have several testing platforms available. In the months since COVID-19 became a global pandemic, our lab has worked tirelessly to secure swabs, testing kits, and viral transport to ensure consistent and reliable testing. The world's primary manufacturer of nasal swabs was also affected when Italy became the first European nation to suffer a terrible outbreak. We now utilize a combination of 2 in-house testing platforms, with a third that should be up and running next week, paid for by the Natividad Foundation. We also use the Monterey County Public Health Department and several other reference labs. We continue to build and enhance relationships to ensure our test results are fast and reliable. Natividad anticipated that we would see an increase in our COVID-19 patients. Quality created a daily COVID-19 dashboard. It outlines in visual graphs and charts so our staff has access to an at-a-glance PDF of what they needed to know. One of the most important things Natividad's leadership needed to decide was where we would put suspected and confirmed COVID-19 patients when they arrived. We also made plans for overflow for ICU and COVID patients so we could safely care for everyone. We already had a good number of isolation rooms throughout the hospital. We soon realized that if we could create a dedicated, isolated unit in the hospital, we could conserve PPE. We also planned how we would medically care for our hospitalized patients with severe COVID-19 complications. We ordered more ventilators and medicines and worked with the Monterey County Health Department and other local hospitals to secure doses of the antiviral remdesivir. Fortunately for us, we've had some of the best and the brightest come up with innovative solutions to address the COVID-19 pandemic. In January, Natividad's emergency response team got to work on how they could keep admitted patients with suspected or confirmed COVID-19 separate from the general patient population. We knew enough not to bring the patients inside the hospital. In fact, our first tests were done in a drive-through format. We soon set up a small tent to test and screen patients presenting with COVID-19-like symptoms. In the coming weeks, we erected a large, air-conditioned and heated tent with several rooms. The entire tent is negative pressure. The entrance to the emergency department soon became a hub for triaging patients. After quickly realizing pop-up tents wouldn't be a long-term solution, we set up sheds outside of the emergency department for admitting, the quick look nurses, and security. A watertight tent with lighting was brought in to house a portable X-ray so we could easily determine if a patient's lungs were showing the telltale signs of COVID-19. Engineering tackled logistical issues such as fuel supply and refueling issues early on by establishing a dedicated vendor to ensure that the generator had enough fuel. The larger tent setup was later hardwired to Natividad utilities. In addition to our medical tents, we knew that not all of our patients would be medically stable enough to be treated in a medical tent. Some would need to go inside for care. For them, we created dedicated isolation rooms within the emergency department. Our engineering department made modifications and brought in special filters and equipment to ensure that the air that was in the room stayed in the room. Engineering installed cameras to ensure the safety of the area. In March, Natividad Foundation purchased a secondary tent for non-COVID-19 patients in case our emergency department filled with unstable patients with coronavirus symptoms. The tent was donated by Natividad Foundation's Talc 2020 and Community Foundation for Monterey County COVID-19 Relief Fund. The footprint and make of the tent matched the existing tent for a seamless setup and installation process. With funding help from Natividad Foundation's COVID-19 Response and Resiliency Fund, our engineering department converted our existing 12-bed pediatric unit on the third floor to an isolation unit dedicated to caring for suspected or confirmed COVID-19 patients in the safest way possible. We fabricated plexiglass inserts that we installed into windows so special ventilation units could push air out of the windows and create a negative pressure environment. This retrofit project allowed us to hospitalize COVID-19 patients without burning through our PPE and a safer environment for our non-COVID patients and staff. It also proved to be a vital part of mitigating spread. Today, every room on the third floor of the hospital now has the capability to become a negative pressure room. While engineering was building the alternative care spaces dedicated to isolating COVID-19 patients, IT was working hard to support the technology needed to operate in the new spaces. IT purchased an additional 25 mobile workstations, WOWs, so nurses and doctors could easily care for ICU patients in their negative pressure, novel respiratory isolation rooms. The WOWs also have video capabilities for inpatient telehealth for COVID-19 patients. Thanks to capital improvements over the last couple of years into the wireless IT network, the hospital was better equipped than ever to access patient care systems, electronic resources, voice calls, and video services from anywhere inside the hospital and outside operational areas. We responded to workforce challenges posed by the pandemic by leveraging productivity tools such as Zoom video conferencing as an alternative to in-person meetings and remote workforce access for those assigned to testing sites or sheltering in place. With guidance from quality, Natividad drastically reduced the amount of foot traffic that came into the hospital. Visitor policies were updated and rewritten based on the CDC's new recommendations and what we were learning about the disease. With guidance from the state of California, we initially paused our elective surgery program. When we restarted it months later, we began COVID-19 testing all patients scheduled for surgery within 72 hours of their procedure. This action limited unnecessary exposures so we can continue to do elective procedures safely. We fast-tracked launching telehealth programs. Soon, our doctors in Diorigo Family Specialty Services, Natividad Medical Group, and our cardiology center were taking appointments by phone and Zoom calls. We installed Prox badge entryways, which only allowed those with Natividad-issued badges to enter the building at unstaffed entrances. Seeing coronavirus ravage assisted living facilities, we closed down the public entrance to the acute rehabilitation center completely. We ensured COVID-19 signage was installed throughout the hospital to alert patients of what to do if they presented with a cough or fever, and employees of PPE requirements, high-risk areas, and more. For those patients who enter the hospital, trained staff take temperatures using thermometers purchased by Natividad Foundation and ask a round of questions to ensure they weren't exhibiting signs or symptoms of COVID-19 or had recently traveled to an area known to have high levels of community spread. As the disease emerged in those early days, those screening questions were limited to Wuhan, China, then all of China. Within months, nearly every major country and city was affected by the virus. Tents are set up outside of the main entrance for patients who don't pass all the screening questions, but still need to be seen for essential services. Staff comes down in the appropriate PPE and escorts them into the facility or performs tests in the tent. Perhaps one of the hardest decisions we made was to implement a comprehensive and strict visitor policy. We know having connections with others is vital in the healing process and can have an incredibly positive effect on patients' prognosis. It's a very emotional experience for patients to be away from their loved ones during this difficult and complicated time, and we were concerned patients would miss that support. Led by nursing, patient experience, marketing, and IT, we created a virtual visitor committee to provide patients access to virtual visits via FaceTime, Skype, and Zoom. We found ways for our patients to maintain connections with their family and friends and ease isolation. With the support of Natividad Foundation, we purchased iPads for every department so hospitalized patients without smart devices can visit with their loved ones through video while the no visitor policy remains in effect. In addition to keeping our patients safe, our priority has been to ensure that our workforce stays healthy. The Employee Health Department has been instrumental in managing employees who need to quarantine, maintaining logs that are required, and monitoring other safety measures to ensure that our employees monitor for symptoms, stay home if they need to, and return to work when it is appropriate to do so. HR developed healthcare screening questions for employees, which requires all employees to attest at the start of their shift if they have any COVID-19 related symptoms. Employee Health continues to perform N95 fit testing and developed a color coding system for employees to easily recognize the mask they are approved to wear. We utilized a specialized fit testing machine purchased by Natividad Foundation in addition to other testing procedures to ensure accuracy of testing. With guidance from Quality, Natividad's universal masking mandate policy began in April before any national or regional policies were implemented. We set up free appointment-only drive-through testing for asymptomatic employees and their family members to provide reassurance to all of our staff. Many employees were allowed to work from home beginning in March, and others were provided alternative work schedules. When disposable isolation masks were in short supply, the Volunteer Auxiliary, inspired by the Million Mask Challenge and with financial support from Natividad Foundation to purchase supplies, enlisted 74 community volunteers to make 1,700 reusable, washable masks for our employees to wear outside of work. Natividad set up a dedicated bilingual hotline for both Natividad employees and Monterey County residents to call with questions about the novel coronavirus.
At Natividad to start addressing questions, concerns of our community and to help educate them about symptoms, signs and symptoms to look out for, and also just to kind of provide like a pre-screening assessment over the phone with the folks that call us and to let them know whether we feel that they need to continue to self-isolate or to come in and get tested or just other medical advice related to the COVID-19.
At Natividad, we believe that regular, transparent communications are essential, and it's important that our entire team understands our response to the evolving COVID-19 situation. Each department and team member has an important role to play to ensure our staff, patients, and community's health and safety. When the COVID pandemic hit our community, there were a lot of questions from our workforce. It was and continues to be a top priority to keep everyone informed. Hospital administration began communicating regularly with employees about Natividad's response to COVID-19 through email. Chief Medical Officer Dr. Craig Walls sends out weekly COVID-19 emails, including a week in review and discussing new advances and new developments in COVID-19 treatment and prevention. In collaboration with the unions, both SEIU and MCRNA, we created a series of videos to provide our staff with updates of our COVID-19 preparations. So far, we have produced 35 videos. We invite employees to reach out to us to ask questions, express concerns, or comment on our responses to the coronavirus, which we address in video updates from Dr. Gray. In February, a Joint Information Center, or JIC, was formed with Natividad, the Monterey County Health Department, and the other area hospitals, Salinas Valley Memorial Healthcare System, Me Memorial Healthcare System, and the Community Hospital of the Monterey Peninsula. Public information officers and communications teams from each of the hospitals are part of the JIC. The hospitals have developed unified communications about proactive and precautionary measures should the virus spread, including a PSA and marketing campaign. While we always produce communications in both English and Spanish, we realized early on that we also needed to connect with the estimated 30,000 Monterey County residents who speak languages indigenous to Mexico and little to no Spanish. We were worried that language barriers would prevent them from having accurate, science-based information about COVID-19 and how to take precautions to stay healthy. In February, PRI The World visited us and aired a story to 2.4 million listeners, highlighting Natividad's partnership with Natividad Foundation's Indigenous Interpreting Plus program to produce public service announcements about coronavirus and shelter in place in Triqui, Mixteco, and Zapoteco.
If you look for information about the coronavirus in the world's major languages, English, Mandarin, Hindi, Spanish, you'll find it easily. But for less spoken languages, the harder it becomes to pass on critical information. The World's Monica Campbell headed to Salinas, California, an agricultural community where interpreters are trying to break through language barriers and get out urgent information about the virus.
Natividad's family medicine residents, registered nurses, and faculty went directly to the fields to educate through in-person presentations held in Spanish and English.
Industry as a whole is trying to do its part to stop the spread, and that includes a partnership with the Grower Shipper Association and Monterey County's 4 hospitals to bring nurses and doctors into the fields and into the plants to educate workers on COVID-19.
We want to make sure that we're not just telling them these things. We want to make sure that we have a communication and a safe place for them to tell us what is what are some of their concerns, and giving them those resources and saying, well, these are what things that we have. These are places that you can call. These are the resources that are available.
Natividad Foundation provided interpreters to help with this vital community education service. To date, the program has presented to more than 5,000 agricultural workers. Natividad Foundation's COVID-19 Relief and Resiliency Fund donated 5,000 reusable, washable masks to agricultural workers. In addition, one of our family medicine residents secured a donation of 40,000 reusable masks from an apron maker in Southern California. Natividad created a PSA television commercial and a series of radio ads. Filmed entirely in Salinas, you might have noticed some familiar faces. The ad stars Natividad staff members and their families. We produced welcome videos in English and Spanish so our hospitalized patients could learn more about our COVID-19 response. These play on televisions in hospital patient rooms and let patients know what safety precautions we're taking and what to expect while they are here at the hospital. With guidance from our Board of Trustees, we drafted our first COVID-19 focused newsletter. Produced in English and Spanish, the newsletter went to 50,000 households in the Salinas area. We are currently working on our second newsletter. Since the COVID-19 pandemic began in early March 2020, our facility has gone through changes to accommodate patients in need of testing and treatment of the virus. Clinical areas were converted to isolation units, and we added equipment and supplies and substantially increased labor resources to meet our patients' health needs. The estimated extra cost incurred due to COVID-19 during March through June have been in excess of $10 million. In addition, our hospital paused elective surgeries for months, as well as outpatient procedures and visits, which further reduced income. In response to decreased revenue and increased expenses due to our response to COVID-19, hospital leadership closely monitored all expense categories and took actions to minimize losses, including moving the hospital to dynamic staffing for a few months, which reduced work hours by 20%. Finance also took a proactive approach to apply for federal grants to supplement our COVID-19 spending and reduction of revenues. Natividad has received approximately $6 million from the CARES Act for revenue losses. We are actively working on reimbursements for costs incurred and future costs via the Federal Emergency Management Agency, or FEMA. All these efforts help shrink our financial gap. Our achievements, awards, and comprehensive response to the COVID-19 pandemic have been made possible with the help and support from our Board of Trustees, Board of Supervisors, the Natividad team, Natividad Foundation, and countless others. Thank you to every one of you for your tireless work responding to the coronavirus pandemic and strengthening Natividad during these uncertain and unprecedented times. It has truly been an extraordinary year, and we feel more prepared than ever to care for Monterey County no matter what. For Hospital Week 2020, we made a video for our dedicated team members, which we will share now. Thank you for your time. Thank you for your support.
Thank you to our frontline workers and hospital staff.
You make a difference every day.
When you put our patients and community first.
We appreciate you working so hard to keep us healthy.
During these uncertain and unprecedented times. Most of all, thank you for caring.
For everyone, no matter what.
You're all heroes. Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you. Thank you.
Thank you.